Lee Chapman was driving down this stretch of Gerrard when she made her way up to the lights, and that's where she noticed him. A stranger slumped over on that park bench right there, clearly showing signs of distress. He was blue and not breathing. That's when the registered nurse pulled her vehicle over. She got out of her car, she assessed the situation, and she provided him with naloxone. Now, paramedics arrived shortly afterwards and they took over his care, so she's not sure if he was able to survive the overdose. But police say there have been a major spike of overdoses in the downtown core over the past 36 hours. In fact, there have been 20 overdoses since Thursday. 4 of those have been deadly.
I'd hate to think that, that people are waiting unnecessarily. These are preventable deaths. They're entirely preventable.
Lee Chapman carries her naloxone kits with her pretty much everywhere. That's why the PhD student was able to intervene when she saw a man overdosing last week. It's why she may have saved his life.
If people are getting trained in CPR, they need to be trained in naloxone and be able to administer it. And certainly first responders need to have it and carry it and be able to administer it. Otherwise, in my view, they shouldn't be first responders.
In Toronto, only paramedics carry naloxone, the powerful drug that reverses an overdose. Police say there are no plans for officers to start carrying the drug, despite the recent spike in overdoses. Since Thursday, there have been 4 overdose-related deaths in the downtown core and 20 overdoses. Police believe heroin laced with fentanyl is to blame.
The deaths were heroin related that had fentanyl mixed in. Whether this is a symptom of a wider problem, we're still waiting to see.
The latest death, a woman found in a Regent Park stairwell this afternoon, is believed to be fentanyl related, although the investigation is still underway. But the sheer amount of overdoses in the core over the past 36 hours prompted police to issue a public safety alert, warning users that bad drugs are on Toronto streets and actually killing people.
If you have people out there that are handling this type of drug, to use extreme caution when doing that. And somebody knows who's got these drugs. Somebody knows who's doing this, and we need them to contact us.
But Chapman, who lost her own brother to an overdose, says it's equally important for all first responders to start carrying the life-saving kits.
OPP have them, police and other jurisdictions have them, and they have responded and saved lives. And there's really no there's no risk. If you administer it and it wasn't an overdose, it's not going to injure the person. It's not going to do anything to them.
Now, police are asking anybody who may have any information about the fentanyl-laced drugs to call them or to remain anonymous and call Crime Stoppers at 1-888-222-TIPS. Now, in the meantime, the Harm Reduction Alliance has posted some tips online to help users better protect themselves, including making sure that they use with other people, or if they do have to use alone, to ask family or friends to check in on them. And of course, they suggest that you pick up your own naloxone kit, which you can do for free from a Toronto Public Health Centre.